This isn't just a number. These are patients. These are Manitobans.
COVID-19 has taken its toll on the healthcare system, with hospitals continuing to care for patients with the virus. But this has also led to many surgeries being postponed. According to Doctors Manitoba, there are approximately 110,000 surgical and diagnostic procedures on hold due to the pandemic.
These are people who are waiting in pain. They're suffering. They're fearful. There's so much uncertainty and concern over their health, and families are suffering too, seeing their loved ones going through this. So it's quite staggering.
According to a new report released by the Canadian Institute for Health Information, Manitoba experienced the most significant decrease in surgeries. Between October and December of 2020, there was a 29% decrease of surgical volumes in Manitoba, compared to a 4% decrease Canada-wide.
Manitoba physicians and surgeons are ready to roll up their sleeves and do what it takes to address this backlog, work extra, go the extra mile to really tackle this issue.
Doctors Manitoba is making some recommendations. It's asking the province to address the backlog by having a fixed date and having monthly reporting on the size of the backlog and on actions to improve the situation.
We'd like to create a task force, not just of health leaders, but of frontline workers, so physicians, nurses, technologists, allied health professionals, all joining in on a task force to actually look at the issue, look at the data, and come up with actually a concrete date that's attainable, reachable, something that we can work towards and finally get this dealt with.
We'll work with Doctors Manitoba and other stakeholders out there to ensure that we have, that we're doing the regular reporting. Will be a part of that, and that will all be established.
NDP health critic Uzoma Zaguera provided a statement on the surgical backlog, which reads in part, "Frontline healthcare workers have been drawing attention to this backlog for months. Manitobans waiting for cancer biopsies, hip replacements, and other vital procedures deserve answers and action." Thompson says Manitoba's doctors are motivated to begin reducing the backlog.
We're ready, we're willing, and we hear our patients, we see you, and we're ready to do what is necessary to get you healthy again.
In Winnipeg, Alex, Karpa City News.